Hi, my name's Sarah. I'm going to be the nurse practitioner doing an exam on your abdomen as well as your peripheral vasculature.
Okay.
All right. So if you're okay, I do have a recording for the class, so I will kind of like announce things as we go through.
Perfect.
All right. Are you having or noticed any like changes with your bowels recently, or having any complaints with your bowels?
No.
All right. Any abdominal pain at rest or with eating, anything like that?
No. No pain.
All right. Awesome. So I'm gonna have you go ahead and lay back so I can do
Okay.
a good exam of your belly there.
This is
Yeah. So first I'm just kind of like taking an inspection, just looking at the belly, noting any pulsations, masses, hernias, anything like that that I can see right away. I do not note anything. Skin is evenly colored all throughout. And I'm gonna go ahead and just take a listen to her abdomen now. I'm sorry if this is cold.
It's okay.
Okay, I do note active bowel sounds in all 4 quadrants. I'm also going to take a listen here at the aorta, the renal arteries, the iliac artery, and also the femoral arteries for any bruits. We'll start right here in the middle for the aorta. I'm going to do the left renal artery. Right renal artery. Move down to the iliac. And then femoral. Okay, and I do not hear any bruits on over any of the arterial sites. Okay, as we move on, we'll do a percussion over the abdomen. Start with the lower. And then I'm going to be looking for the liver span. So I'm actually going to start with my percussion kind of under the second intercostal space. I note that it starts to get dull around right here. And then I'm going to continue to percuss up from the lower portion of the abdomen. And note that we get dull again around here. So we'll measure that. And her liver span appears to be about 7 centimeters. I'm also going to palpate now. As I go through and palpate, I just want you to tell me if you have any pain, discomfort, anything like that. We'll start with a light palpation, and then as I go around the second time, we'll do a more like deep palpation. You might feel a little bit of pressure, but it shouldn't be painful. Okay?
Yeah, no pain.
And then just right under the umbilicus. Any pain, pressure, tenderness?
Nope.
Okay. So I'm going to kind of like scoop under and take a nice deep breath in. Okay. You can palpate the liver there. And then I'm going to come around to the other side and we will palpate the spleen. So I'm going to also have you take a nice deep breath in. Any pain, tenderness? Okay, perfect. Okay, now we're gonna do a little bit more of a deep palpation. Like I said, you might feel a little bit of pressure, but you shouldn't have any pain or discomfort.
Okay.
Okay.
Yeah, definitely pressure, but no pain.
Okay. All right. So for this next portion of the exam, I'm gonna have you kind of sit up, and as you sit up, I'm gonna just be looking at your abdominal muscle, also checking for any masses, hernia, anything like that. So I'm gonna have you go ahead and sit up there. Okay, we know a normal tone, normal abdominal muscles, and I don't see any hernias or anything like that. And then I'm gonna have you kind of spin a little bit, yeah.
Okay.
So I can palpate the kidneys. Okay, so now I'm gonna have you just kind of sit there, and I'm gonna percuss over the costovertebral angle.
Okay.
So I'm gonna go right under where your ribs, and you're gonna feel a little bit of pressure here. Okay.
Okay. Ooh. Mhm.
Any pain?
No.
Okay. Just do the other side now.
No pain.
Okay, good. Okay, now that we have completed the abdominal portion, I will do a peripheral vascular assessment on my patient here. So Sophie, I'll have you just kind of spin around, please. And see if we can get this angled a little bit better. All right. Okay. So again, just noting even tone throughout, even color. I don't notice like any pallor, blueness, any discolorations in skin, vascular discoloration, any abnormal, veins popping out, anything like that. So I'm just gonna kind of feel your skin. She feels nice and warm, even throughout. I don't note any edema, any swelling, any abnormal findings as far as her skin goes. I'm going to take a look at her hands. She does have her nails painted, so I'm actually going to flip her hands over to do her cap refill assessment. Okay, and we are less than 3 seconds. And less than 3 seconds on that side as well. Do you have any pain, tenderness, numbness or tingling in your hands, toes, any of your extremities?
No.
Okay, cool. And then I'm going to just kind of take a feel for your pulse here. So starting with your radial. It's a nice strong pulse. Say about a +2. Move up to brachial. Nice and strong as well. Let's see, it's also about a +2. She has nice, even, strong pulses throughout both radials and brachial arteries. I will kind of just do a quick for your carotid. And the other side. Awesome. So for this next one, I'm going to have you kind of lay back and bend your knees a little bit so I can feel for your popliteal pulse.
Okay.
So we're just going right under the knee. Okay, nice strong pulse there. And same here. And a nice strong even pulse on both popliteal arteries. And then for her feet, sorry, you're good. Just rest.
Oh.
Yeah, just rest your feet. That's perfect. Dorsalis pedis and posterior tibial. And again, she has nice even pulsations through both dorsalis pedis and posterior tibials. I'm gonna have you go ahead and lay back, and then for the last portion of this exam here, it's a little pillow. And just rest back. Okay. Get in here. It's nice and easy. So you can lay your head back a little bit. I'm just gonna do a little inspection. Just looking for a little jugular vein pulsation. And again on this side. And then I'm also going to listen to the carotid arteries as well for bruit. Okay, everything sounds clear. I don't note any bruit, and I did not feel a thrill when I was assessing earlier. The other portion of the exam was also done with the abdominal portion, listening to the aorta, renal arteries, iliac, femoral artery, just to assess for any bruits. So if you do have any questions or concerns or anything with your abdomen or your peripheral vasculature.
No.
All right, thank you. Bye.